I'm glad we do, chum bucket. There we go. Doesn't want to cover fetal ultrasounds because of obesity. That's crap. That ain't right. Why aren't the girls working? I ask myself that every single day. I ask myself that every single day. Why aren't the girls working? And I have not come up with a plausible reason yet, other than the fact they always are watching fucking Netflix on their phones. Do what? Cat's being a smartass. Cat should not be being no damn smartass. Of course, I'd rather her be a smartass than a dumbass because we've already had a couple of dumbass moments this morning. Yes, it is raining here, and it's I don't know. It said it was supposed to snow, and it hasn't snowed yet. It was like supposed to snow 30 minutes ago, and it didn't. But was there?
What up, Daniel? Happy New Year!
Yeah, Happy New Year.
It's January 10th.
What's January 10th? Who cares? Dude, you have been hateful and bitchy all morning.
You have.
Oh my God.
Side of the wrong bed.
No, I woke up perfectly fine. You the one that woke up on the wrong side of the damn bed and been being a bitch all morning long. Yeah, huh? Because yeah.
No.
You have been mean to me all morning. Bullshit.
Bullshit, where's your crown? Who likes that?
That was Christmas 6 days ago. And I wore that motherfucker a little bit this morning, too.
He did. His crown.
And Christina, I will take care of that person. And just watch, I'm finna take care of Stephanie. It's called a shovel and a 6-foot deep hole.
He got loud or whatever, and the guy was like, "Oh, so is that your kid?" And I was like, "No, that's my boss." I'm like, "Well, that just sounds like what do you say, a jolly fun
A jolly fun office.
Jolly fun
Oh,
office.
oh,
Yeah,
oh.
we're so full of Dolly.
Good Lord.
Hey, everybody.
Stop him by to say hello from Memphis. Hello, Memphis.
About his family. You have any funny Christmas stories about the family this year?
No, funny Christmas story from this year. Oh, so my now 5-year-old shot the 18-year-old in the eyeball with a Nerf gun. My 5-year-old was downstairs. The 18-year-old was upstairs. Yeah, he got amazing. He made that Nerf dart fly and hit him right in the eyeball. He fell over and said, "My eye!" We do medical billing and patient advocacy and scream at insurances all day long, and blah blah blah. Mm-hmm. My 5-year-old don't give a shit. He'll beat the hell out of you. He ain't scared. The 18-year-old's girlfriend, he got mad at her last time she was over there, and he threw a Hot Wheels car at her and hit her in the head. Oh yeah, he was mad at her. No, she was being like, they were playing, so to speak, And I guess he felt that she took it a little too far. So he got pissed off, walked across his bedroom, grabbed a Hot Wheels car, threw that motherfucker, and hit her right in the back of the head, and then run down the stairs laughing on behalf of providers and patients.
He is a mini Daniel, yes.
Hmm.
I have to talk about this because it has haunted me since Jessica told me.
Okay, yes, we have to have this conversation about the raccoon. So I started doing like a fun fact for the day. Right? Fun facts of the day. So my
Okay.
fun fact of the day yesterday was the human anus can sustain up to 9 inches before a raccoon can fit in a hole up to 4 inches. As small as 4 inches. So you can fit 2 full-size raccoons up your ass. If Debbie thought this was wild as shit. She talked about it all day yesterday. And in our messages, you were asking what the raccoon is. You were like, what? Elisa said, huh? That's what you're talking about.
It has literally just
Baffled her.
I am baffled.
She wants to go get raccoons to stick up her ass now.
No. So like no. But think about it. What if that raccoon is really pregnant? Like your butthole is like
Why would anybody
Leonard.
stick 2 raccoons up their butt?
I don't know. That's what I said.
Why do we even care about this?
Well, okay. She's doing the fun fact. She's like, the fun fact was your anus can stretch up to 9 inches without damage. Sustain up to 9 inches without damage. And then, into the fun fact, the raccoon can squeeze into a hole.
I'm like,
Were you on my payroll when you found this shit out?
Listen, what happened was, something. I was looking at your Facebook and it just happened to show up.
You were looking at my Facebook and somehow a raccoon going up somebody's ass was on. No, I don't think so. So now you admit you was on fucking Facebook while you're supposed to be working for me.
Just like I'm on TikTok right now, getting paid.
That's because I'm on it, doing that, on payroll. That's different. You were busy looking up how to shove a raccoon up Stephanie's asshole.
Oh, that's not
You were the one that sat there and was fascinated by it and then put it out in the group message last night.
yeah, and it scared me.
Why do you think it's scary? How in the hell did it scare you? You're the one that's always talking about buttholes.
Are you planning on stretching your butthole more?
No, but I was just imagining, like, you ever seen a porno, whatever the bell.
Have you ever seen a baby before? Like this big around?
I mean, I pay them for this shit. Apparently.
He said apparently.
Oh, for God's sake. I don't.
Do you know what it says that you have 0 people online?
Well, it shows I have 85.
I know, on here it says you have 0. Oh, there it goes, 92.
Yeah, see, haha. I mean, I just don't understand why we are. That is not a fun fact.
That's what she said.
That is a load of dumbassness that nobody cares about.
Listen, we were sitting there working, and just
No, I believe you were sitting there. I don't believe you were working.
Oh my god, I love that raccoon.
So she can shove it up her ass now. Here we
I
go.
love it like a little baby.
See, y'all wonder why I get nuts half the time. It's because we're dealing with raccoons up somebody's asshole.
Water or vodka.
Is that water or vodka?
I'm not sure. I didn't drink it. I just poured it.
Drink it, drink it.
No.
Can I trade my boss for yours? If your boss is a dick, no. Your boss will not laugh with us.
No. No. Are y'all two coming in here or what?
I don't know who did the experiment. It was on the Google and the Facebook. About the raccoon asshole thing.
Well, we're like done with the whole raccoon hootie thing. Change of subject. My mom is great.
Who was it that had COVID?
My mother-in-law.
That's what I thought.
My mother-in-law has it right now, and my brother-in-law has it right now. No. Renee has probably got bronchitis, and she gets it every single year at this time.
Hey, Hunter and Ariel do too. We
So,
Daniel, what do you think's gonna happen election?
ooh, I don't know. It's really tough to. I don't know. I mean, there's a lot of senators and U.S. representatives, whatever, said that they're gonna vote to not certify different states and all of this stuff. That part of the election, the Constitution. I don't know about. Um, but I will say I'm not real sure. Something crazy gonna happen. I just don't know what it's gonna be. They're not gonna consider bronchitis, COVID, probably, or anything else because my wife is a nurse practitioner. She'll diagnose herself. But the exact same symptoms that she's having is the exact same symptoms she has every single year at this time. Every single year.
She wasn't a nurse practitioner when she went to the doctor.
Yeah, we don't even need to test you.
Yeah, don't.
So sick of COVID. And then, now of course, they've got the vaccines out, and then people are now bitching about the vaccines. I mean, did y'all see the governor from New York that he basically said he doesn't trust the vaccine if it came during Trump's administration, so he's not real sure if he'll let it into New York.
That did happen. Yeah.
I've dealt with Oscar insurance. It's the preservatives. Yeah. Are you able to work for me remotely from Kentucky? I mean, I have remote people, but probably not that far.
When I rode the ambulance with Ariel when we went to the room the other day, I asked the guy if he took the COVID, and he was like, yeah. He said, you want to see what I did to my wife? Because she texted and was like, oh, we don't. Or texted and asked if anything could happen, and whatever.
Side
So
effects.
yeah, that's the word. So he gets this little tiny hand and he's fixing in his pants and it's coming out of his boot and he's like, oh, I grew an arm. And he said it was a lie. Oh my god. What happened with your daughter on Christmas? Because we have a crazy Christmas story.
So she shoved her daughter down a flight of stairs and cracked the back of her skull open. Waited 2.5 hours to call 911 while her daughter sat there and bled to death. And then gets in the back of the ambulance and tries to make out with the paramedic on the way to the hospital.
So my dad got my children a fake buck and bull out of a barrel for Christmas. So they're on it. Well, they're on it, and I was bucking them. That my oldest and my youngest were on there together. Well, I don't know if my oldest fell off or jumped off, but my daughter had a hold of him, and she went with him. And hit the bottom of the.
I don't
She
believe
got 4 staples. She hit the bottom of the. And instead of just getting her in the car and driving her to the hospital, we had to wait 10 minutes for the ambulance.
I don't believe Sonny not one.
So this is the buck and
She
bull.
shoved her daughter down a flight of stairs.
That's the buck and bull.
She either shoved her down a flight of stairs or she hit her with that fucking pole. She hit her with that pole.
She didn't really cry.
I mean, basically,
They
didn't for a lot of times they don't. They didn't with Christian. No. Like with Christian. Okay, so Dr. Hutchins, and it was like one of his first. It was like one of his first shifts back in the ER after being in family practice, for so long, and they bring the sample gun. You play that, and I mean, Dr. Hutchins just pop, 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 pop. Got the stitches done, and then so it was like Christian had like a little bit of blood that was like oozing, and Dr. Hutchins goes, "Oh, he He's bleeding right there. Right there. I mean, and the motherfucker kept backing up. Yes. Like he was scared to death of the blood, Dr. Hutchins. I looked at Jeff and I said, would you hand me a rag? I'll dab it for you. Okay, good. God almighty.
The nurse was like, you hold her. I was like,
Now,
is there someone else more qualified? That's what she said. She said, isn't there someone else more qualified? She was like, "Is there the
now,
I said, no.
now Hayden,
You don't know.
when he got his staples in his head, Jace Taylor was the doctor, and Jace numbed him. And he shouldn't have, because that was worse than the staples.
That's what the doctor said.
Right.
The staples maybe, but when you get stitches, if you don't get numb, just
Yeah, we'll numb you for stitches.
Yeah, well, and like Hayden, when Hayden like busted his little eyelid open, Dr. Clark said, okay, I'm gonna go get some numbing medication. I said, the fuck you are? We're gluing this. Okay? Watch this. Reached over Pete and said, grab the glue.
well, the needle for numbing is
Right! Besides all that, I can have a good enough hold on my children, they ain't gonna fight.
See, when they had to give Jaden stitches, I had to pretty much lay on top of her, and they like wrapped her in a sheet, and two nurses were pulling it aside.
Oh, they wrapped her like a
And I'm
burrito.
like laying on top of her. I'm like,
Hey,
let's go.
that's either called the papoose or the burrito.
I had to just put my arm around Ariel and hold her head. I was like, I don't wanna. I did not wanna.
Companies working with Aetna call setting up virtual doctor appointments with new clients.
Yes. But that's just because that company's trying to get money. But I mean, I would never do it.
Have you ever witnessed anybody doing the gunpowder and lighting it on fire on themselves?
No.
No, it's actually that's what they do like in the military. It makes their bullet wound.
Yeah, it cauterizes the wound is what it does.
Oh.
Right.
But it's just more flammable. Yeah. It just is quick. It's just
Well, it's because the gunpowder gets hotter and it damn near liquefies by setting it on fire on the skin, and it then basically almost liquefies and becomes like a glue wherever the bleed is.
my cousin is a military doctor, and it's like a artery, something like that.
Oh yeah. Now you know that there's also what's called wound dust,
Yes, we're taking cases right now.
and it's not gunpowder. It's a special powder that you pour on the wound, and it heats up automatic on contact. It does it. You don't have to set it on fire.
Do you cry when it happens?
No. So a couple of things y'all do need to know though is because if you have an insurance plan off of the marketplace, if you have an insurance plan off the marketplace, your plan starts January 1. And so, you know, your deductible, co-pays, all that stuff starts over January 1. So just because you might have met your deductible by the time December rolls around, well, you got to meet it again in January. So just be careful about that. Well, Wired Rose, that's why you should have shopped your health insurance. If you're losing your health insurance, you qualify for what's called a special enrollment period, and you can call Cannonball Solutions at 254-918-5444, and they can get you re-enrolled in a better plan for cheaper money. So there's that. Just FYI. So,
Are you the third party working directly with the patient?
yes. Yes. They told me that nothing was changing from our plan, that we were going to be re-enrolled. Well, if you didn't actually want to be, it still qualifies as a special enrollment. Call Cannonball Solutions.
Kiki.
No, Kiki's not there anymore.
What?
Yeah.
Who's with her now?
Well, I mean, she's still got Carolina and Brandy, and she's got a new girl named Kim. Kiki is pursuing her dream in criminal justice. So, no. So I'm taking on 3 cases in the last 2 days. One of them y'all probably seen on TikTok on some of the For You pages. Little baby's name is Wyatt. He's got gastroparesis, and we're getting him approved to go to Children's Hospital of Philadelphia. Well, Melina this morning tried to commit blackmail and collusion to the mother because the mother, there's a GoFundMe account set up for the little boy, okay, to get him to Philadelphia, to get him what he needs because he's been to Oshner's Children's Hospital in Louisiana, different places, and they haven't fixed him. CHOP knows how to fix him, and so we're trying to get him there, right? So GoFundMe was set up. The GoFundMe money goes into an account that is in her dad's name, all right? Not hers. She can't even touch it. Melina calls her this morning and says, be careful on what you post on social media because we know how much money you have gotten on the GoFundMe and we can report that for the SSI against your son.
Oh my God, seriously?
Yeah, they're trying to blackmail him. Can you imagine the conversation that's going to go on between me and Melina over that? Oh, yeah. Come Monday, because they're not in today, the people I need to talk to, come Monday morning,
Not to mention this is the same one that face marks
that she didn't even know about. I'm gonna have Melina jumping through their own ass. Yeah, I mean,
That's like literally insane. Like,
it's
if
called.
we have, like, our advocacy page,
Well,
don't add me.
the problem is because that Melina's gotten so much pressure that they're now, and they know that they fucked up. Now they're trying to figure out a way to turn it around to get out of it, and they're not going to be able to because, like, they didn't give her. She's at a caseworker, a case manager with Melina since October 1. Okay, she's been requesting one since before that. The last time she requested one was in November, and they never told her that she had one. She's had one since October 1. The last time she requested one was in November. They never told her that she actually had one, and this case manager has never reached out to her. I told them they've got until January 1, or me and Mississippi Medicaid are going to have a conversation.
Hey, I have a rep here that says they've dealt with you before.
Uh-oh.
It says, the first comment says, hold on, let me find it. I remember working with him when Medicaid credentialing.
Yeah, that's Steffi. She used to work at Texas Medicaid.
And then she said he used to call directly for Texas Medicaid. People hated him, but he would only talk to me.
Yep.
You were hated? What?
Oh, hell, I mean,
Every day and twice on Monday.
yeah, Texas Medicaid and I, no. And that's why, and okay, so the girl that has commented on that, she was working with me on getting a provider credentialed.
And you were being a dick.
No. She saw all of the issues that Texas Medicaid provider enrollment had screwed up
She
on.
made people cry?
Yes. And she emailed me that she knew what the issues were with provider enrollment and that they had actually screwed up. She had emailed me that, and they fired her the next day. And so she went to a totally different department of Medicaid. Oh yeah. She was absolutely, I mean, she messaged me and said, just so you know, I'm not working at Texas Medicaid anymore. I said, what the hell happened, Steph?
You bitch.
And she said, because I sent you that email yesterday.
She's with the state now.
Yes. She used to work, it was the same with Accenture
crazy.
Operations.
Like, reps.
She is awesome. I mean, she really was. Now, the first time her and I actually linked up, oh, good Lord. You could have heard both of us screaming at each other for 5 counties.
Oh, God.
And by the time it was over with, we became very good friends, and we
That
both
bothered me thinking we were
conspiring. Yeah.
Oh my god.
And so, by the time it was over, the first time Steph and I had worked together after we'd stranded each other and everything else,
Yeah, we got
we
into it.
we had come together and actually became friends because we both realized that we are both just defending our position, and like I'm defending my provider, she's defending her position in Accenture operations. So she was defending just as hard as I was, and she was attacking just as hard as I was. And so we found common ground that we were both, very passionate, believing what we were doing and trying to do the best for everybody involved. And after that, hell, we'd call each other all the time for
I was
issues.
like, okay, we can't get this done until I get this done.
Yeah. She was wonderful. She was wonderful. I love Steph.
Oh, I love you, Debbie.
Not that one. This one. This one. This one.
Yeah, I was going to be able to get stuff taken care of easily because I had a good report with this thing.
Yep. She had a good report and she knew what she was doing, and she looked at everything in its entirety and figured out that we'd already sent everything that we needed to send. People just weren't looking at it or weren't looking at it correctly, and she was able to fix it. And so then we get another case this morning
Have you ever had to deal with us before?
of a baby that I got messages on it, and they called finally this morning. A baby that was 4 months old
5 months old.
died.
I see you its whole life.
They died. United Healthcare has denied everything. Says he either A, has other coverage, B, doesn't have coverage at all with United Healthcare, or C, United Healthcare is secondary.
I called.
And
I got on. Eligibility for that from the day or still active today, even though he passed on the 16th. Still active today, and under like primary, it says that they are the primary.
Yeah. She's got like
No
over.
secondary. Over $1 million in bills.
My understanding is the number of bills that she has is over 900 bills that accumulate to over $1 million.
From 3 different
And
hospitals.
I told the people that messaged me who are friends with her and told them to tell her, you don't pay a fucking thing and you don't stress about this.
Nope. That's how
And don't even worry about being charged for this. A 4-month-old baby died and United Healthcare can't seem to get it right. Bullshit.
The mother whose baby's only passed 2 weeks ago is fighting this. Like, can you imagine your baby passing 2 weeks ago and you having to go deal with this shit?
Yeah, she's not going to deal with this shit at all. At all. We're not. No, she's not. No.
What do you think the best insurance company is for? The easiest insurance.
To work with,
Mm-hmm.
really, the easiest one to work with is probably United Medical Resources.
EMR?
Yeah.
I've never felt with them. I don't have to call anybody on
There's not. They pay very well. Yeah, and they really are the easiest. We don't have to call them. They email a settlement proposal, and it's usually pretty high. We can negotiate easy with them and done. Medical billing strategies. Yeah. Well, Medicaid's got issues. And then I'm waiting on a phone call from one guy who's literally at a hospital right now for a transplant, and Blue Cross Blue Shield won't get off their ass and approve the surgery. He's been in the hospital. They approved him to go to the hospital for the transplant, and now they're not approving the transplant. I'm hoping the guy calls. I just, You're not going to send a patient to the hospital and then not approve it after you told them we have your organ, your insurance is good, and then all of a sudden the insurance goes, no. This is shaping up to be just like a little 5-year-old that got the heart transplant in California that United Healthcare tried to fuck over. Ugh. I can't stand that shit. I can't.
Who on here said that they did a lot of good on insurance? Let me ask you a question. Marketing.
Happy New Year's. Sorry, I went on my rant.
It's a really fun.
It is. And now I will say, to me, this is me. As far as Christmas goes, to me, Christmas was very off.
This year?
Yes, it was very odd. I mean, now we still do the same thing we do every year. My wife's family, my mom and dad, and and then my aunt's house, just like we've done every year. Nothing changed. Nobody was like
My kid.
all masked up, worried about the run. Nothing like that, right? It just felt off. It didn't feel right. It didn't feel Christmassy. I mean, everybody had Christmas decorations up. You had Christmas food, stuff like that. You have your family up, but it just didn't feel. It just didn't feel right. It just, I mean, and I can't put my finger on it. It just didn't feel right. And I still can't put my finger on it. I mean, we should all, for shits and giggles and everything else, be extremely excited about today being the last day of this extremely fucked up year
For real.
and ready to start off the year tomorrow. We should all be excited about that, but I get the feeling that really none of us are. It's like, it's off. It's not, something doesn't feel right.
Everything's still fucked up.
Yes.
Listen, that's the reason why we all decided to work half a day, because it's just fucked up. I'm not in it. And I think that's the reason why I never really get food today. I'm not in
I mean, I'm not really in it either. Did I ever get bullied in school? No. No,
You didn't get bullied in school?
no.
I did.
But I was physically abused by my first stepfather for 15 years. So
I can see that.
I basically walked around with what people call the resting bitch face and was ready to knock the fuck out of anybody that crossed me wrong.
Is that the reason why everybody doesn't like me?
It's your voice.
We don't have
No, but Stephanie answers the phone arrogant and pissed off.
Would you shut up? Like, I listen to the way she answers, and I'm like,
Every fucking phone call, she's ready to fight. They could be calling and saying, I think you are doing an absolute wonderful job and I love you. And she's like, this is Stephanie. You're doing such a good job at what?
not what? Well, you don't know me.
No.
I always feel like she's upset when I send her phone calls. Like,
It's my North Carolina medic.
It has to do with something that I know that you know.
I
Yes,
know,
you
like,
do.
that Medicare,
That shit.
I was
No,
confused
on
as
the
fuck.
weekend.
And you have got to stop playing the dumbass card.
Because whenever the weekend is over and Monday comes around, it's like you forgot everything.
We do medical billing, coding, and patient.
I mean, but somebody could call up and give you, my God, Ed McMahon could walk up in here with $1 million from the Publishers Clearinghouse and you would be pissed off at him. Because she does. Lord, I know.
How many times do we come to you and you're like, I've done showed you this, and we're like,
But I have. And half the time they don't pay attention to it. And that's my problem is I hate repeating myself. I can't stand it.
No.
It's just like coaching basketball. Once we've gone through the play several times, and we've ran, like, let's just say one play for several weeks now. And then all of a sudden, the fourth week, they fucking forget to play, and we've been doing it for 4 fucking weeks.
Well,
How do you forget it?
because we work with little kids and not big kids.
Listen, y'all. It's just, it's,
Anybody donations to help our
What you need, Breezy B?
insurance and our bios on our
ready to.
I mean, it just, I can't stand repeating myself. And now there is a level of arrogance to me, and I wholeheartedly admit that. Because, and the reason is because this business, medical billing, coding, patient advocacy, it makes complete and total sense to me. The rules make complete, no, I can't say they make complete and total sense. I know all of the rules. And a lot of them don't make sense, but I know them, and I know the tricks around them. But the arrogant part of me too, sometimes when y'all come ask a question, I'm sitting here going, you bunch of dumbasses. This is easy. And I forget that it's easy for me.
For you.
Yeah.
Like literally, you can go in and find me a pre-op in 2 minutes. Something that I've been looking for a whole day. Like I can't find the fucking pre-op anywhere. And you'll be like, oh, for you.
Oh, I know.
And
You just gotta, honestly, you just gotta let him be me. You just gotta let him do it because later on he's over it.
I know y'all look. You know how proud I am of myself that I have not left here crying since I started.
Daniel's been doing this business for how long?
20 years.
20 years. He was an ambulance driver.
No, I was not.
Oh, she said
I meant to say EMT, guys. I really thought
I cannot hit her or kill her right now because we're live and there would be witnesses, okay?
that's rude.
But I mean, like I said, medicine, really, it comes easy to me, and I forget that, y'all haven't been doing this for 20 years, and I forget that what is easy for me to figure out and look at 5477 is not what is easy for me to look at and understand is not easy for y'all to look at and understand. I mean, which half the time it's because y'all are idiots, but the other half of the time, really, they're not idiots. She must be on the live, I bet. I bet she's on the live. I bet she's on the live. I bet she's on TikTok right now on the live.
Jaden, you're on TikTok. Yeah.
Jaden, if you're on TikTok, I'm going to go kick the fucking door down to your house.
Look at this shit.
There's the kitty.
Look at this bitch.
There's the meow meow.
Stop sending medical records.
You don't need a name tag.
Oh, that was from that.
Your manual well-being has been checked.
No, my son's manual.
This says your manual well-being. Well, I checked your manual well-being when you walked in the door, and it ain't well.
You know that his psychiatrist asked me what I did for a living today, and I told her I did ambulance and medical billing, and she was like, "I thought you were a nurse." And I was like, "What do you mean?" And she's like, "Just your terminology,
Well, I think it's because
the way you talk."
yeah, we know a lot.
Well, and that's the thing is, y'all been long enough to where y'all know just enough to be dangerous. Well, you would if you would just fucking retain it.
Yes.
This doesn't have to be.
If you just
No.
like sit there and
Ginkgo biloba, bitch.
when somebody calls you with a problem, if you just sit there and just don't even ask us questions and you just say, fuck, I have to handle this, like, you'll get it. Like, you can't ask us shit.
Well, and you have to stop flipping the fuck out when you don't know. When you don't know, like she don't know the answer, and so she doesn't know where to go look, even though she does know where to go look. But somebody will call them and she'll be like, and there's this guy on the phone, and he's, and I'm like, my God, you're jumping around like a fucking monkey.
Okay,
Yes. She started in October because I hired her on my birthday. At my birthday party. But still, the issues that you have dealt with.
But she still thinks that she can look at Medicare, even though she knows she can't look at Medicare. Like, why would you look at Medicare?
Medicaid. She can run Medicare ID numbers.
I can't look at claims. No, I wasn't trying to look up a claim. I was trying to get that availability.
Eligibility on availability.
Right, and not only that, if you would just listen to that guy explain himself, he gave you the right number.
He gave me like 4 numbers, and I put all of them in, and all of them was right.
So let me ask you this. Let me ask you this. Did you write down each number he gave you? No, you did not. So you cannot remember the numbers that he gave you. You put in the wrong numbers because she pulled it up.
Did you say it was a Medicare, Abby? Medicare, yes. So a Medicare has 11.
Do I pay my employees to go on insurance for Karen? Yes, I do.
All you have to say is go sign your red, white, and blue card and give me the 11 symbols, numbers, whatever, numbers and letters that are on that red, white, and blue
Numbers he gave me, none of them had letters in them.
For one,
And that right there gets people pissed off too. Because Stephanie will be on the phone with them and she'll go, okay, ma'am, well, for one.
Well, for one.
Oh.
If you just listen for a minute. Oh, I know. You can say that if you
like, listen, it's my turn. I heard you. Let me talk. And so that's the reason why
I just let him talk. I just let him talk, and when they're done talking, I'm like, okay, well, can I explain it to you?
I was talking to a lady yesterday, and she was like, I'm not paying this. My mom's bill. She said, you can add it to somebody else's. I said, man, that's illegal. She said, what you're doing to me is illegal. So like find someone else and just add it to different people and have someone else pay it off.
Now let me ask you this, Sonny.
What is it?
On an estimated average here, how many Medicare numbers have you seen since you worked for me?
Not a lot because of this availability.
No, it has nothing to do with availability or anything else. When you look into your patients, how many Medicare numbers do you think you looked at? Okay, so if you looked at them and one of them, and out of the 4 numbers that he gave you, you should have known that none of those was not right.
It's going to start with a number.
That's what I'm saying. I mean, you may be like,
one number, 2 letters, or it's going to have 2 letters, 2 numbers. 2 letters.
you may be book smart or something, or whatever it is, but you have got a massive case of the dumbass.
Massive case of the dumbass.
Massive case of the dumbass.
Because for one.
See, here we go. For one.
For one.
Wait, see, I guarantee you, if we had liquor up here, every time that bitch said for one, we'd be passed out on the fucking floor. Drinking. I mean,
She's on the phone with an insurance company. She'll say, for one, or what's the other one you say?
Listen.
You're not
Listening.
Listening. All the time, listen.
You're not letting me listen.
Yes, you're not letting me listen. That's what she said.
Go back to America.
Yeah.
And everybody's like, she's
And then it was Daniel.
I'm the fucking owner, bitch.
No, we didn't have the Social Security number,
And then it was
Kristen, because half the time down here in Texas, they don't give us the face sheets, and when they do, they black out the Social Security numbers.
Fucking University of Cincinnati Hospital that doesn't want to fucking give a shit anymore.
Or Bethesda North.
Or St. Bernard's in Arkansas. No mercy. In Arkansas. Here, but I just go for the doctor.
It's
perfect cream. I gave it
completely.
to her on a silver platter.
Yeah, just here's the thing. Jessica doesn't want to work to find anything. She wants you to bring her in the piece of paper and go, here you go, here it is. She'll write something. What? Move out of my way.
Okay. So I have a conversation about Jessica. Jessica's worked here for a year on the 6th. How much have I increased my provider in a year? Almost $20,000 a month.
So she puts this one in here to me instead of figuring it out. She puts it in my box.
What I say? They pay on 9/16, but they refuse to pay this one.
Why?
It says it right there.
Says it right where?
Please submit proper documentation.
So print out the chart.
That's all I do is print a chart out and send it all to them. The whole chart. The whole entire chart. Okay?
And she knows that. She knows that. I didn't say you weren't good at what you do. Was this ever billed? A workers' comp? I don't know. Was it?
I don't know. This was supposed to be you. Can you help?
How was it? Did you not look at the claim?
Yes, I did look at the claim.
Did you see a claim for it?
No.
Then obviously was never billed.
So then I have to make a claim for it?
That would be advisable. See what I'm saying? She just wants me to. She just wants me to hand her stuff on a silver platter.
Here's the thing with these. Half the time you say, well, of course, if I make the claim, I've already printed it and mailed it. You tell me that all the time.
But did you see a claim?
That's what I'm saying. Even the ones that I see in there, it might
But
have been
did you?
created,
But
not mailed.
did you see a
It
claim?
might have been created, but not mailed.
It doesn't necessarily have to be mailed. It can go electronically.
Some of them do.
Some of them do. But if there's no claim at all, that means there's no claim. Make one. Can a patient ask a doctor's office to recode something if they code it wrong? You can, but they don't have to because it's truly according to what the diagnosis is, what the impression is. You may think that something was all related to pneumonia, and it could be all related to diabetes. Okay. So there's so many variables. But
We fight like a married couple, not like brother and sister.
that's true. Let's see if I missed anything. Somebody, Heather Prince right here says, yes, I'm from Arkansas. Listen to this. Heather Prince 36 here says, yes, I'm from Arkansas, and St. Bernard suck.
Yes, completely. I deal with them, and they take forever to type shit back. They won't even freaking talk to you. And I had to send requests like 3 times to get them to send it.
Insurance carriers try to scare people to keep them quiet because they don't want to be exposed for their mistakes, and they don't want somebody sitting there looking up truly the letter of the law. They try to throw at you all of these different statutes and everything else, but what they're giving you is one little sentence in the statute instead of the full statute. Okay? And they don't like it whenever we call and go, no, yes, there is this statute, but look right here, this, and this. This is where that patient falls. That it's like they want to look at the very first thing they can look at to deny and not look at anything else.
Well, it's like Blue Cross right now that's doing their whole, they don't even look at the claim. Denied medical record.
Yes.
Denied medical record. They don't even know.
Yeah, that's what Anthem does.
Doctor, same thing. The doctor sees the hospital. That means the doctor doesn't necessarily work for that hospital.
Right. There's most doctors nowadays are not employed by the hospital. They are contracted, whether it be independently contracted or they may work for a physicians group that contracts with that hospital to provide physicians.
Do you still use the emergency physicians association?
They don't use Cowboy Capital. They use the Texas Health Physicians Group.
Oh, the THP now.
Yeah. So let's see. What is this? Everybody's going cat go live.
I'm right here. Blah, blah, blah.
And you're right too. There's a lot of and you have to understand too that most of the time when you call your insurance carrier, you're calling literally a call center. All right, there's a call center.
And a different call center than we call.
There's a call center in San Angelo, Texas, for United Healthcare and one other insurance carrier, and it's in the Sitel building, which is close to Angelo State. Yes, and so they haven't been told anything about how to answer the phone and read off a computer screen. They truly don't know the situations. And it sucks because they're supposed to be giving you what you're supposed to be doing, and they're taught hooked on phonics is what they're taught. The hospital sent me a bill stating you over $13,000 for your parents' bill.
Are they living?
Mm?
Question.
And $13,000? That's kind of what I'm wondering. That's what, yeah, I mean, Pebbles is right here, Mike. It looks like they put you down as the guarantor. Now, you can take yourself off as the guarantor if you were not. I mean, you're the son, not, you're not a parent of these people.
Still doesn't mean you're guarantor.
Right. So, don't. I mean, I would call them and get them to be off,
Well, it's like
off
we
the
had that
guarantor.
conversation where that grandma took her granddaughter and they were billing her instead of the parents. Well, you signed the consent on a minor. You are the guarantor.
Right.
Until the parents call up there and have it changed.
So you got a bill from your insurance carrier saying you owed them money for your son. I'd have to know more, Tennessee.
What exactly do you want to know about the contract that the doctor's offices and hospitals have? Because we charge them so much.
You need to get off as the guarantor. Take yourself off as the guarantor, Mike.
And then we have a contract.
Why is a pre-authorization required when a procedure is needed to save the patient's life? It's not. Emergency procedures or whatever do not require prior authorization if it's medically necessary.
If it's an actual emergency
Yeah,
situation
but I
now.
told them their mother's liable for their bills. Oh, okay. Here's the thing, Tennessee. You just hold the policy. Since you're the subscriber, you've got to send them the divorce papers that show you are not responsible for the medical bills that the mother is. That's what you've got to do.
Network when at the ER. So I don't know where you live, but like Stephenville, we only have one doctor in our ER. So if you go to the hospital, whether that doctor is in network or
And
network,
and
And you can file that with your insurance company
Well,
because there was only one available.
and here, yeah. So and here's the thing too with that. The nurses, the registration staff, the doctors, they're not going to know who's in network and who's not. They are not even allowed, like in Texas at ERs, they're not even allowed to deal with insurance or anything for you until your ER visit is over.
Mm-hmm.
And the doctor, your insurance is not even on your chart until you're done because the doctor doesn't treat you based on what insurance you have. It's basically a safeguard.
yeah.
That's why whenever you get ready to get discharged, somebody comes in the room and gets all of your information.
So then
and all of that stuff.
why does people get on and say like, oh, they're trying to get me out of this hospital because I have no money?
Well, if you're already admitted, then yes.
If you're already admitted, then there's going to be a lot of stuff that requires prior authorization and all that, and there are a lot of Medicaids that are just difficult to deal with, and the hospital staff doesn't want to take the time in dealing with them, so they try to pass the buck and have somebody else deal with it.
Somebody who deals with it all the time.
Yeah.
See, the difference is in the emergency room, they don't want it so that they're trying to refuse treatment because of your insurance. That's illegal. If you're there for an emergency situation, whether it's an ingrown toenail or whether it's a heart attack, it's still an emergency situation and they can't deny you care.
Now, Tennessee, so does your son live with you? Because if your son lives with you, then yes, you are responsible for the bills. Right.
But the hospital's not going to go split that bill 50-50 and send it to different people. That's up to y'all to fight it out. Not
Okay.
the hospital.
I heard in South Carolina that if a hospital sent a bill to a collector, it's already written as bad. It is. Whenever a whenever a medical provider, or any provider for that matter, whenever a medical provider sends a bill to an actual collections agency, they write that off their books. Okay, they write it off as bad debt.
Weeks in January because
Yeah.
they're getting rid of them all.
They write it off as bad debt, and then they they send it to the collection agency and get what they, because basically once they send it to the collection agency, whatever they get is found money. They're not counting on that money to survive.
Oh, I said there'll be
Is
a
what it
slew
is.
of people getting collection agency things over the next 3 or 4 weeks.
Oh yeah, and that's the thing. If any of you owe medical bills, get ready, because come January 1, everybody is sending. Yes, they're dumping collection bills to collection agencies right now to get it off of their books for 2020. Yes, they can write that shit off as bad debt. Especially if you're a nonprofit hospital system, ambulance service, or whatever. They want that shit off their books so they can't show that they have a potential to make a profit.
So either A, they wrote it off, or B, someone was nice and paid it for you.
No, do
Magically disappeared. She used to have a collection from 2018 of my daughter that just magically disappeared.
you'll have to read that to me in just a second because I was reading this.
Oh, I thought you were
So due to HIPAA, the agency can't get money due to them not having the claims. Yes, they can. They still have the claim. They just don't own the debt.
Yeah.
Okay? They have the claim. They don't own the debt. They sold the debt.
It's just like if you have a house and you change your finance company sold it to another finance
Right.
company.
You still owe the money.
And that collection agency may sell it to another collection agency
Yes.
in 90 days. If they can't get a hold of you, they're going to send it to somebody that's more hardcore.
You can dispute collection agencies for HIPAA reasons, but you've got to be able to prove it. Now, what you can do with the collections agency is you can tell the collection it is not illegal to sell a debt. It is not illegal at all. I mean, half the time, banks, when they do your mortgage, they sell it to a mortgage servicer immediately. No, it is not illegal to sell a debt that's in collections. And there's something going around on TikTok that says this, and it's not true at all.
No, they can sell it. I mean, we just sat on a house 3 weeks ago, and it was in our closing papers that our loan, and we're not in collections, but our loan will probably be sold to another company within 90 days. We'll be contacted.
Yeah, but like I said,
they have to honor the.
They have to honor the agreement. Yes.
But it'll be sold to somebody else as far as actually receiving the payment for it.
Exactly. Now, tell me what yours.
I don't remember.
Oh, okay. Yeah, it's not in Tennessee. It's not true. They can sell the debt.
And say, pay this like they do every day after they say something about HIPAA?
No, you can't. I mean, that's not going to help you.
So most of the time, like when you go to the emergency room or something like that, and you sign paperwork, it says in there that if you don't pay within a certain amount of days, then they can give it to you.
One of the last couple of paragraphs on the rendition acknowledgement form. It's on there.
Hey,
the
Ron.
Ones you never read.
Yeah, the ones that you always just sign and never read. They're like, do you want this back? And you're like,
It's just gonna get thrown.
Okay, so Larry, send them copies of the death certificate, and make sure that they have it. It needs to be a certified copy. Okay, send them a certified copy of the death certificate. The service is needed to save the life, but is it? It may be needed to save the life, but is it deemed an emergency? And honestly, I know it sounds weird, but in insurance eyes, those are two different things. And in the law's eyes, those are two different things. It's needed to keep them alive, but it may not be an emergency if they're able to keep them alive in, via medication or whatever.
Well, I mean, technically, insulin is needed to keep somebody alive, but it's not necessarily always considered an emergency.
Right. How do you find a $23,000 bill? I gotta know more, trucking. Anyway, we love all of y'all too. It's just about noon. I mean, it's like time. It's like time for us to get out of here. We've been here for an hour, and we time for us to get out of here for New Year's. Plus, it's gonna get to freezing, and none of us want to, slide around on the highways or anything else. So, from all of us to all of you all, Happy New Year! Yes, don't drink and drive.
AAA does a free
Yeah.
towing tonight
Yes.
for drunk drivers. Who don't want to drive?
I
They'll
can't
tow
tell
their
you the
car.
number of times because Cliff volunteers for Luke, or he works
Yeah.
for Jason. I can't tell you the number of people that call him when
And
he's on call.
here's the thing:
Pick them up.
if you drink and you drive,
Ride with them.
if you if you drink and you drive and you go to jail, okay, yeah, but for the fourth time, if you drink and you drive and you go to jail, call the attorneys at Looney, Smith, and Conrad out of Hempstead, Texas. They are licensed in all 50 states and will help you beat your drunk driving rap.
Don't go to jail, but if
So,
you do,
but if you do, call Looney, Smith, and Conrad.
thanks everybody.
Happy New Year!